This is the If More Let's Divide podcast.
Yo, guys, Charlie, welcome to the If More Let's Divide podcast. Another episode, another week. And Charlie, we are coming through live and direct from our studios. And Charlie, as usual, with me, my co-host, Fred. Fred, what did happen?
What's good, my G?
Chai, shout out to Atunwa the Guitar for powering, season 7. Shout out to, all our subscribers, followers, and all those who have told someone about the podcast. Today, we are going to talk about mental health, a topic that is recently been on my radar. Everybody's talking about therapy. Everybody's talking about mental health.
Yeah.
Why, Charlie?
It's become almost like a fad.
Yeah.
And for me, that's dangerous sometimes because I think people take words that have meaning and are based in diagnosis and stuff, and they start throwing them around willy-nilly on social media, and everybody starts saying things. Oh, this person is a narcissist. This person is gaslighting. This person is this person is that. So it would be good to get the perspective of a professional.
Yeah, from a professional.
It's important, but
Yeah.
I think, sometimes social media, people just they carry things go
Charlie.
extreme.
I mean, I hope that after this episode, some of your questions will be answered. So without further ado, help us welcome Dr. Lai, a psychiatrist in training at the Kolebu Teaching Hospital.
Booyaka, booyaka.
Dr. Lai,
Hi,
what's up?
I'm good. You?
I'm great. After weeks of prepping and trying to get you here, we finally have you here.
Yeah, I did.
Yeah, so I thank you for coming through. And mental health is one, topic that's been on my, on our radar for a while now because, like Fred said, everybody, it's almost for me losing its importance, its substance, because everybody's talking about stress, depression. Hey, I'm triggered. Fred, I'm triggered. Hey, I'm triggered. That is triggering. It was just right to have a professional, a professional here to dissect, to divide, this issue for us. Chai, so welcome to the podcast.
You.
So we've had a few doctors on the podcast.
Oh,
Yeah, we've had a few doctors on the podcast. I think season 6 we had Dr. Rekun.
Yeah.
Is this season 6? Yeah, season 6. Yeah, we had
have you
Dr.
had any surgeons?
No.
Yeah, I don't like surgeons, so I wanted to clear that. I don't like surgeons, so I wanted to clear that.
Why?
It's okay.
Oh,
We'll talk about it later.
Like surgeons, like they.
Yeah, those are cuts, yeah.
Is it
It should be a story for
triggering?
another day.
Is it triggering?
Yes, they're triggering.
Wow.
Yeah. we'll talk about it some
But I'm
other time.
sure you have surgeon friends.
Yeah, I do.
Wow, that's crazy.
It's like psychiatrists and surgeons are like different end of the spectrum. So usually there's a little clash sometimes when we are supposed to like work together. That's why I mentioned that.
Can you?
Oh, okay. So psychiatrists usually do a lot of talking. Like the more I speak to you, I ask some directed questions. I'm able to like work towards a diagnosis. Surgeons don't talk so much. Like there's a hernia, there's a growth. They just get to it, and they just like do the cut. Some of them have some God complexes, you understand? And they are not so people friendly. So you see, psychiatrists are more people friendly, like get to conversations and all of that. Surgeons are quite the opposite. That's why I mentioned that. Yeah, but there are lovely surgeons out there. Just
Yeah.
Generally, if you're a surgeon, I'm a little. So it's my own bias.
Wow, Fred, that's so frank and crazy.
Yeah, but I've read some things actually about surgeons in like
Really?
journals and stuff here about the God complex that she
Yeah.
mentioned. It's almost like the thing where you have BMW drivers. They are people say BMW drivers behave a certain way, or there's some clash usually between architects and engineers, structural engineers. Because,
Oh, okay,
you know
yeah,
what I mean?
yeah,
It's
yeah,
that
yeah.
kind of thing.
Yeah. Oh, wow.
Yeah.
So there's that thing.
So, are you saying that when you talk to us, you can figure us out? please face
Right.
face him. Let's just say he asked this question.
So sometimes, yeah, but it's very important you don't take a lot of things out of context. So maybe you could say something. I can't jump on that and say, oh, you have this condition. Exactly. So maybe if you're in a consult room, then I can go to tell them whatever you said. But then in casual conversations, I've learned to like sort of filter things out because I can't be going around diagnosing everyone. You understand? But sometimes people have that are living with their conditions that are not medicated or whatever. Sometimes in conversation, you can actually pick those things up, but then it's not your place to like, say, I think you have this and all of that.
Wow.
But then because it's usually through conversations, yeah, there's that. So, so a lot of psychiatrists are like that. Like, can sort of like read you because our examination starts from the moment you walk into the room. We look at your appearance, your behavior, your mannerisms, and all of that. So yeah, it's like that sometimes.
Yeah.
Nobody should dampen the way they are.
I don't think either of us would do
Yeah.
that. I think it's fun to have an expert be able to, do what they do, even if you're not aware that they are doing it. But my question is, how do you even define psychiatry? What is it for the lay people like us? What is the study? What is the science of psychiatry about?
Okay, so it's a science, like you said. So it's usually the study of the mind. So we have neurosurgeons that do the brain, like there's tumor, everything, they go in there. But then we do more of the mind. So it's more of like a sort of like an abstract, like your mind, like your thinking, your thought.
Not the muscle itself.
Not the muscle. We don't do anything with the muscle.
Of it,
I mean, we can view your brain on a CT scan on MRI to see some deformities that's causing a change in your behavior. But we look more on your thought process, your behavior. That's what we usually do. So it's a study of the mind, like behavior, patterns, that kind of thing.
So what would you say in your practice has the most, I guess, defining feature of your work? Like, I don't know if this question makes sense, but like, this is the baseline for us. We need to start from here for all humans, or whatever the case may be, to be able to start doing our breaking down. Like, where's the equilibrium point?
Okay, so I mean, for a psychiatrist, you should understand that everyone is different. You should be able to differentiate between the normal and the abnormal.
Okay.
So usually, like, we do more of like, there's a change in behavior. Someone is acting. So to start off, mental health is sort of like a state of mental well-being that allows you to like interact with people, to work and be meaningful in the society. So anything that comes against you reaching that goal, anything that comes between you interacting well with your friends, your family, your work colleagues, anything that comes between you and working hard, being productive, and like adding society in general, it's sort of like a attack on your mental well-being. Understand? So that's basically it. So anything that will stop you from interacting well, anything that will stop you from being your best self, being productive, we have to look at that. You get it? Because as a human being, your mental should be at a point where you should be able to have normal relationships. Okay? You shouldn't have a lot of like toxicity and all of that. You understand? You should be able to go to work and work well. That's why sometimes at the workplace, if someone is not working well, you just don't jump into the lazy boat. You have to find out what is going on, what's not making a person work well, you understand? So it's a lot of things coming into play. So so for most people that come to our workplace, usually it's because there's a behavior change. Because that's what distinguishes someone who needs a psychiatrist from someone who is okay. Some people are also not okay, but the behavior change is not as much to warrant help. In our families, in our society, there are people that are a little different, but like they're not doing a lot of disruptions. But if it gets to a point where they cause enough disruptions or the behavior changes enough to be a risk to themselves, to others, then there's a need for you to bring them to a psychiatrist. You understand? So yeah, that's about it.
Okay.
So more about behavior patterns, thought patterns. Maybe in school, little kids, this kid is not picking up as much as the others. What is going on? You understand? You have to bring him or her to the psychiatrist. Let's evaluate the child. Let's see why he or she is falling behind or he or she is not able to fit in. So it's usually those who come to the psychiatrist usually because there's a behavior change. There's something that's a little different from the norm.
Okay.
So unlike going to the internist or the physician with maybe diabetes and all of that. I mean, diabetes will not affect your behavior, except maybe you're worried about it and get into a depressive mood. You understand? But we usually work with behaviors and thought patterns and all of that.
Okay.
You have said norm like twice or three times, right? What is the norm? And with this, like for the last example that you gave, like a little child in school who isn't putting their best like the other kids. And you are the professional. I feel we all come with different,
Yes, it's like
strengths, and all that. I'm not supposed to be on Fred's level. Fred isn't supposed to be on my level. Fred can run 100 meters. I can run 200 meters, right?
Yeah.
And it's fine. So what is the norm? Like, is there some set rules that, every child is supposed to hit this, peak and or?
If we talk about the norm, it's quite broad, so we'll sort of like look at it from the child perspective. I mean, when you go to school, the curriculum and the teachers are supposed to like sort of gauge every child and what they are supposed to achieve in a term, in a week, and all. So it's usually as I talk about behavior and all of that, because the teachers will be able to pinpoint that this kid is sort of falling a little behind. What could it be? And that's when the norm comes in. What if in their family that's how it is? Or according in the teacher's perspective, what is the norm? Have I seen this pattern for a long time? Maybe it's normal that at least maybe 20% of the kids will be a little behind, 20% will be ahead, and maybe like 60% are in the average. So the norm is sort of like different. But at least there's like, so I mean that'll be for the kids. Usually we have to take into account the teacher's perspective and the parent. Okay, so I mean, but if the child is falling behind too much, they will know. I mean, because of their experience, they will know that maybe the kid is not doing too well. Then you can bring it to a psychiatrist. So sometimes when you come, we do a lot of assessments. We use a lot of tools. So we just like we just let the children play. And as I talked about mannerisms, all of that, you can pick those things up. Then there are tools we can administer. There are things we can tell the parents to look out for and everything. So in the end, it could be that the child is just normal. Maybe just like his norm is that maybe he's not into this.
Yeah, exactly. Yeah.
So it's a lot.
So and the reason why I asked this is this. I think now it's better. But back then, our time, right? When so the friends that I grew up with, right? There were some who were so sharp in class. And note, we were all going to school because parents wouldn't allow their kids to even play football. Football wasn't a thing. Like now we have parents taking their kids to football trainings and all that. Back then, our time, it wasn't a thing at all. And me, for example, right? I love school, but I don't love school. There are some subjects that once it's time for those subjects, I check out. Math, one. Science, I wasn't with it. So the times that I was with it, if it comes to calculation, science, that's not my thing. But reading, science, I love it. But math, I think if I'm not lying, from class 5 all the way to secondary school, I wasn't able to solve one math question. No lie. And teachers would make me, especially secondary school, from Form 1 to Form 3, anytime it was time for math, the teacher would sack me.
Oh, no, that's not good.
because I wasn't going to concentrate. English, cultural studies, social studies, I am there. I am there. So they would say, oh, Akwari there, they were born. But meanwhile, I might be good at painting. I might be good at math. I might be good at, I might be good at, something else. That's what I'm saying. Like, what is the norm? How do we evaluate the child for us to know that, no, this child isn't supposed to even sit in class? Because if you think about it, once you know how to speak English right, that's all. Go and do what you have to do. That's what I believe in. Or Fred?
I think some of this stems from standardization.
Yeah.
So the society decided that, I think when Doc was speaking before, she was trying to say maybe 20% would fall behind, 20% would be ahead, 60% would be in the middle. And for governments, for institutions, for people who are trying to probably regulate society, they need some sort of yardstick to measure, right? So then I'm thinking that the process would be how many of our people fall within a category that are able to get themselves to perform certain tasks at certain, how do we measure? So they are not customizing to see that, oh, Mutumbo is good at XYZ, but math, he has some kind of, and then they would rule that out. But instead of understanding to express it that way, they will probably put you as low performing mathematical student. And because math is so important to certain levels of cognitive performance, they might just rule you to be set. That's my guess. That's why maybe they were carrying it out that way.
It's crazy.
I want to add, most teachers, I think teachers should have some sort of psychology training. I think in their training should have
very important
psychology. I don't know how the training institutions do that, but they're supposed to have some of that, because it's supposed to take everything into perspective. You are not good in maths, but then English, social studies you are doing. That means the mind works. So they have to take time and find out why you don't like math. Maybe it's a problem of interest. You understand? So that's why we're advocating for smaller classes, so that teacher can have time for everyone. So it's more of an educational problem around.
We are classes were big. We were 60.
Yes, it's crazy.
69.
So they keep falling. The kids that need a little more help, they keep falling, and they lose hope in themselves and start a whole. And that's the thing about mental health. When usually they're sort of let's say they're sort of injuries to their brain. So you're a kid, you did this math thing, someone ruled you out that you're not going to be good at math. You keep that pain or whatever in you. So then it's sort of stored in your brain. So we have a part where there's emotional processing, emotional storing. So a part of you has kept that thought about yourself. Because when you're little, usually most people when you're little, you're not able to speak for yourself. This is who I am. So usually what the teacher is telling you are, what your parents are telling you are, you understand? So you keep doing this, the kid keeps storing things, I'm not any good. Especially in our society where math and science are there, you understand? So the child carries that on and thinks he's not good enough and all of that. So yeah, it's a lot. It's a lot, you understand? Yeah.
My question about psychiatry, how much of it, the field itself, those of you who study it on an academic level, is based on, or do you give consideration to how much of it is genetic and how much of it is environmental or cultural?
Yeah, we that's actually a very good question. When we are looking at conditions, we look at we have a model called biopsychosocial model. So biologically, what are the predisposing factors? Genetic, it runs in the family. You understand? Socially, what is the culture? What is the religion? What is peculiar to these people? It comes into consideration. Psychological, what kind of person is this person? Is the person introverted, extroverted? What kind of family is the person coming from? You understand? So we take these things into play. So it's a very it's a science. So you can't just get up and just say anything. So going back to the social media buzz lately, everybody's just throwing words around. for most conditions, we have to look at it through the lens of an expert. You can't just say I'm this and just keep.
No, I'm depressed. Like
you can't just say you're depressed. Sad is an emotion. Human beings feel sad. Human beings feel pain. Human beings feel elated and all of that. But then we'll take into consideration severity of it, duration of it. You understand? And usually we are supposed to have like an inbuilt system where we're able to get over our SADs. I mean, this morning maybe we're not feeling good. By the end of the day, you'll be feeling better. Maybe you put on a music that you really like, then you're good. But then it becomes a problem when you cannot get out of it. So for depression like this, you're supposed to feel sad for most days of the week, more days of the week than not, for most parts of the day. So you can't just get up and say you're depressed when just one day. And usually if there's a, should I say a causa? But if there's a cause, I mean, you heard news, maybe your cat died. It's understandable that you're sad. So there's a cause to it. But then you're there, there's no cause, but you're just sad. It becomes problematic. Then now you can't shake it away. It's lasting a whole week, 2 weeks. You can't shake it away. It's becoming a problem because, as I said before, now you cannot interact with your family members because you want to stay indoors all the time. Now you can't go to work because you don't want to interact with anyone. You've lost pleasure in life, you understand? That's when it becomes a problem. So we have duration to what we look at in making a diagnosis. We have severity. We have to take into consideration the society, the environment, and all of that. So for some people, maybe depression runs in the family. So there are times where maybe my dad was having depression. What it means that maybe, and the genetic doesn't mean that so far as your father had, you have it. It could skip you, but it could be in the family, or it could make you a little more vulnerable. So if your father had it and maybe you know you're prone to it, what it means is that when you have a cause, maybe you lose someone in the family, you're supposed to have a normal period of grief. But then, because you are predisposed to depression, you are not able to shake off the grief, then you get sunk into it. So that's why it's important to know your family history when it comes to mental health. Because then you know that, my father and my mother used to battle with depression, my grandfather used to battle with depression. So now that I have this devastating news, like maybe my girlfriend left me or my boyfriend left me or I've been accused or something, you know that you are predisposed, you have that vulnerability already. So what you do for yourself is that you try and seek mental health professional opinion so it can help you get out of that or be able to handle that sort of stressor so that it doesn't let you sink into it because you know you have a predisposition. So that's what helps with knowing your family, the mental health climate of your family. So if you know that this was going on, then you know that, if this cause comes, I need help to get out of it more than the next person. You understand? So that's when it comes to those genetics, you just have to know that, maybe this is what it is. Maybe some people too have maybe schizophrenia running in their family. Sometimes it could be low-lying till an adverse life event happens. Then, you know, sometimes I can say, can I speak? Can I speak? I say, or to say we are in the furniture. You understand? It was always there. He had their family, he had their predisposition. So when he encounters a stress that he cannot, then their brain sort of you understand. But all
crazy.
These things are they are manageable. You understand? It's sort of like I'm always saying this in a consulting room. The brain is an organ. It's just an organ like your stomach. It's an organ like your kidneys. An organ like your heart. We are more understanding of heart conditions like hypertension. I don't have to take medications every day. Hypertension is chronic. Schizophrenia is chronic. Depression somehow is a mood disorder. So sort of like when you sort of retreat for about 6 months, we check to see how you're doing. Then maybe you can get off medications and all that. That's another thing. But schizophrenia is as chronic as hypertension, and it's a thought disorder. So if you understand that you have hypertension, you go to the doctor almost every month, every 3 months, and take medications daily. Why is it hard for you to take your medication as a schizophrenic patient? And why is it hard for you to accept a schizophrenic patient when you accept an hypertensive patient? You understand? So it's a lot. That's one of our main issues in Ghana. Most psychiatrists will say this too. Education. The brain is an organ. It can suffer injuries. It can suffer dysfunction. That's why we are there. But then, sadly, because in our part of the world, anything we don't understand, we attribute it to spirituality. We've had those issues. Yeah. Because the person who is on the street, who is psychotic, if we give care to the person is able to follow our medications, our reviews. The person is just as good as anybody else. So that's one thing we struggle with, and that's what we are trying to put out there, that there's nothing wrong with you if you have a mental health disorder. The brain can suffer issues too, just like your heart.
That's wild.
And one issue with us is that we don't take care of our mental health, because most people know that, for hypertension, maybe I have to stay away from alcohol, I have to stay away from smoking, I have to stay away from fatty meals and all of that. You understand? But most people don't know, how do I keep my mental health in check? Because even for depression, when it gets a severity, you can have psychotic symptoms. Yeah. So you can get depressed to a point where you're hearing voices no one else can hear. You understand? So mental health is very important, because, as I said before, if these things are not put in check, you cannot interact with other people. You cannot work effectively. And that means your life is just going downhill. So it's important to read.
It's vast. It be big, right?
Yeah.
So what are some of the common mental health disorders that are usually passed on?
Okay. So for most of them have genetic components. So I'm going to try and be as plain as possible. So we have psychiatry, we have mood disorders. That's the depression, the bipolar, the other cyclothymia. There are a lot of other little. So let's just stick to the ones that are out there. Bipolar, depression are like mood disorders. So those have to do with your mood. Understand? So the way the depressed person is sad, doesn't have any pleasure in life, eating, sleeping is all in deranged. The same way bipolar people, they can get very elated, very happy for no reason, full of energy, you understand? Hypersexual, overgenerous. And you might think that's good too, but that also has an effect on their life, because it will affect their relationship with other people, it can affect their workplace and all of that. That's for mood disorders. And we have thought disorders, that's the schizophrenia. They're not able to their thought patterns are sort of are not normal, let's put it that way, because there's a little disorder. So, and they also sort of have perception issues. So they could be hearing things that are not there, they are seeing things that are not there, they are feeling things that are not there. So those are thought disorders. Then we have the neurodegenerative disorders. Neurodegenerative is just simply breakdown of neurons. So as you age, those are more related to the dementia. As you age, some of your neurons, your brain atrophies, gets swollen, and all of that. So we have those degenerative conditions. So then we have the child and adolescent disorders too, like the developmental disorders.
It's a lot.
Yeah, so it's quite a lot. So usually our training after medical school, we do 6 or 7 years, depending on the school you went to. You do house job plus your internship, you do it for 2 years. You can become a medical officer for a while before you write an exam and enter psychiatry. And when you enter psychiatry, you do 3 years of general psychiatry. Then you can go into
the different. So all what you just mentioned are genetics, they are passed on.
Most of them are passed on, but then it's not hard and fast rule. So your father had doesn't mean you would have it. Maybe you could just be carrying that. You could pass it on to the next generation or something, but you might not necessarily show it.
Okay.
A lot of things come into play because sometimes even infections, when your mother is pregnant, she picks up some infections, and it just sort of like so there are developmental issues too. When you're developing, you don't develop well, you could have, so it might not be in your family, but when you're developing, something went off, you understand? So there's a genetic component, there's the developmental components, and the environmental component. It can be fine, but then look at the society we are living in, look at the economy we are in. If you are caught up in Gaza and there's all of that happening, you might not have any family predisposition or developmental issue, but you could just have depression or schizophrenia or whatever it is.
Yeah.
So it's very multifaceted.
The discussion around mental health, because we are all coming to, the realization that it's such a broad subject. I want to try and let's maybe get your perspective on also the cultural aspect and the environmental aspect, where I've held personal beliefs about certain issues because I think awareness is enough for, like, if an individual is recognizing that they're depressed, that's, in my humble opinion, half the battle. Because now you can feel like something has changed within you. Right? How much of our mental, quote unquote, health is dependent on our own consciousness, our ability to process around us properly enough to recognize these changes as, so just to give an example, maybe from a certain age to another age, you're very temperamental and you go off like that. But individually, you recognize that this is what's happening with me and you self-correct. And then from a certain age to another age, you become calm, you process things different. What are those pockets of things that are happening and changes that are happening? How do you guys in your field categorize those things? Like, how much of the consciousness of the human being is dependent on the work that you guys, I mean, vice versa, like the work going on, you know that the person is conscious, the person is aware, the person is going to evolve naturally, there's no need for intervention yet, and those kinds of things. How do you guys process it?
Okay, so so that's when the norm comes in. At every stage of life, there's a bit of general, let's say, like checklist. You understand? So we do a lot of we learn a little. We learn psychology, not a little bit. We do a lot of psychology. So from 0 months to 3 months, there are some set of behaviors that are expected. You understand? And to go even deeper, there are sort of behaviors that are expected, and there are some things you could do that could set, that could change the course of life for the kid. But that's a topic for another day. So from 0 to 3, this is how we expect kids to behave. They are like, there's a little bit of room for maybe those who are a little peculiar and all of that. So I mean, that's what I was saying about, it's more about education. You should know what is the norm. We should all come to an understanding of what the norm should be, or at least we should understand all the gray areas. Because, as you were saying, the culture has a bearing on mental health conditions. Because I think when we're growing up, or maybe I don't know if things have changed, we don't give room for depression. They'll say you are lazy, you understand? But then we know that teenagers are sort of normally lazy. When you get into the teenage phase, they are lazy, they think they have this sense of independence, want to do anything they want to do. So you should be able to recognize the normal. And it all comes with education, you understand? So that's why people say parenting, we shouldn't enter parenting because you think it's another stage of life, another thing to like check off your list. Parenting is a big task because there's so many things that you should know, and like you should be able to call in an expert if there's need for, you understand? And the consciousness bit, I mean, yes, so your brain is working. You should be able to be self-aware, to know that, I think I'm doing too much of this. Maybe let me coil back. And maybe another time in life you're doing all of that. I brought in the teenage phase because when people are teenagers, there's a lot of hormone rising up and all of that. So it sort of affects behaviors. So I was about to talk about women and their menstruation. The week before menstruation, the hormones are soaring and they get into dumps and all, like they get sad and everything. That shows you how hormones play a part on your mental health. So for teenagers, you have to know this is what is happening. So when they act like this, it's normal, you understand? So that's what I was saying, mental health has to do with how you interact with people. Because if you don't understand that this is how teenagers are supposed to behave, then you always be fighting with your kid. You understand? You're always going back and forth. And that will cause sort of like a brain injury. So in the future, you see that your relationship with your parents, it's not good, you understand? But if you, the parent, had an understanding of what is expected of the kid in this stage of life, you would have been able to, you get? So also, so for the consciousness, some people, for some mental conditions, they lose touch of their awareness. So we have issues with people accepting the mental health condition when they come to us and we're able to do all our tests and say, oh, you have this. They have a problem accepting it because culturally there was no space for that. What do you mean schizophrenic? I say my body, you understand. But as I was saying before, it's just a little dysfunction that we can correct. You understand? Okay. And the awareness comes into place because in schizophrenia, they sort of lose awareness of the situation. So that's where most of our work comes in. We have a lot of patients not having insight because the condition itself attacks your awareness and your conscience. Like you're not able to even process thoughts. You understand? Then there's another layer of the culture where you're not giving room to, you understand, seek help or even accept yourself. So these are the things we deal with on the regular. Our main issues is the education, stigma, which stems from our culture, because I think out there they are more open to mental health conditions, but over here this is what we work with. So I mean the family, and we have this issue where families would stay with people with mental health conditions till they can't anymore, till maybe they do something very absurd and they can't run in. You understand? But if everyone had a baseline of what to expect, we could all like work faster. We can all. Then one thing that hurts me about mental health condition, because it's sort of like a template for how your life is. For most people, I see them and get sad because maybe he started showing signs that when he was 17, maybe one of these mental health conditions started showing signs of it. The culture the parents wouldn't want to accept that this is the issue. They'll start. I'm sorry if you understand. And we know how these men of God are. The moment they see it, they will start
we beg. We don't want them to come and bash us.
Oh no,
it's
high time. It's high time we bash them a bit.
Yeah.
Oh, it will fear phone and so maybe someone at 17, he started showing signs. If he came in earlier, would have been able to resolve those symptoms, give him medication, and go back to school. But I'm sorry if your baby said 25. You understand? And now we have to work with him, accepting what we are saying, on doing what the church. So our culture is a big stumbling block to us.
Yeah.
So you have a lot of work.
I have Fred said something, and I want to. I wanted to piggyback off it, but I will come back to that later. So a doctor, right? You could have been a surgeon. You could have been a gynecologist, pediatrician. There are so many. Why did you decide to do what you are doing?
Okay, so growing up, I really did like psychology. I really like to understand people, understand why they do this. I was really into all this introvert, extrovert. I used to have a book I used to read. Tim LaHaye was about, I think, the 4 temperament. I would like read it in class and like I was sort of like say, hey, you are a phlegmatic, you are sanguine, you are melancholic. I used to do a lot of that.
Phlegmatic.
Yeah.
Wow.
So from like I think from secondary school, I realized that I like to like get into people's head, try and see how they think, try to like see the different kinds of temperaments and personalities. I used to like that already. And I wanted to be a lawyer when I was growing up because my mouth is I'm always like coming to someone's rescue, trying to like talk for someone and all of that. So I wanted to be a lawyer. My mom said that lawyers are cultural issue here. My mother said lawyers are liars and all of that, so I shouldn't do it. Very bad. Understand? Culture. Understand? So she said, oh, I'm doing well in science, so I should go into medicine. And it was easy for me, so yeah, I just got into medicine. Let's say that. So I got into medicine. I finished school. I mean, when we were in school, it was more of theory. Just read. Then we'll do some examinations, but it's more of like how much you can read. It's more about memory. Like, let's do this, let's do that, and all of that. So medical school came out fine. Now, during the internship, when I was supposed to like rotate through the other rotation, so you rotate through surgery, you rotate through medicine, you rotate through pediatrics and gynecology. So I started off with peds. I was like, this doesn't feel like me. And the first time I went to the emergency department, I was like transfixed. I was just stuck. Like, I was so anxious. Because even though I had the knowledge, I was too anxious to really jump at what I'm doing. Like, maybe I bring people in, do all of that. Like, everything is in here, but I couldn't So I realized that it was not for me. I'm not for the fast paced. Then I lost a patient. I mean, the patient, I think was an RVI patient, an HIV patient who passed on. And I realized that when the patient passed on, till now, I still hold that. Like, I can't deal with losing patients, you understand? I carry it for so long. So I realized that I can't be in any department or specialty that has to do with a lot of losing people. I can't, because it would take me a long time to like bounce back, and I mean that's coming against my productivity. So I realized that fast. Then surgeons, I met a lot of surgeons that weren't really nice. I was like, I don't want to be a surgeon, you understand? Then so I got to psychiatry. So when we're rotating, psychiatry is not part of the mainstream rotations. So I was like, what else is there? But I remember that in medical school, when we were doing psychiatry, I was intrigued. Because what do you mean that people are hearing voices when no one is speaking? What do you mean that I can see things that are not there? You understand? It was intriguing, you understand? So I was like, let me try and get into psychiatry. But then, amazingly, even doctors were like, are you sure you want to do psychiatry? Even now, I have issues with doctors. Like, even doctors that are supposed to be as educated as much as possible, they also like have that stigma going on. Because, are you sure you want to do psychiatry? Are you sure you want to work with these people? I understand. But I think my best friend then, she was like, no, if you want to do that. I mean, I think because she knew me well, she knew like the way I like to interact with people and how to get to, she was like, no, try and give it a chance. And when I got there, it was so easy. It was so easy. And I love psychiatry because a lot of English. Like, you have to like there's a meaning to this. Stick to it. You can't like understand. Talk to people. Like, it's actually it's fun for me. Like, nice. I mean, you come in and I'm able to like talk to you and we'll get to a diagnosis. And I love it, especially when people improve. And I'm like, you see, you didn't have to like stay with it for so long. You could get help for it. So it's a perfect fit for me. Nice. I mean, sometimes I get I have to like shake off all the burdens I pick up from work, or sometimes the stories, because it's more of like it's more of like storytelling sometimes when we are sort of getting everything from you, because maybe I say, oh, maybe or you understand. So when did that happen? When was the first time it happened? I have to get to that context to see if it's normal. That's when the normal comes in. You see, what if he had earphones or earbuds and you didn't see him and you think he gets it? So it's nice. It's very intriguing for me.
There's this thing that I keep on hearing, or I've heard over a period of time, that if you go to the psychiatrist
you got it.
hospital, the patients there, they are not there because of drugs. Most of them are not there because of drugs. They are there because of heartbreaks.
Oh, really?
Yes, it's a thing that's been going on. How true is this?
I mean, there are cases where people come in, and as I was saying before, it's a stressful life. We have to take into consideration that people are different. We all have different stress levels. We can take different vulnerability levels. So maybe you can go through a heartbreak and 3 months you're back, but somebody will need more help. So, I mean, it's part of the case, but it's not predominantly heartbreaks that bring
Okay, so
there.
what cases do you see more?
So, over here, usually for for schizophrenia, which are thought disorder, usually because there's a lot of disruptions in their day-to-day activities and their function, usually we keep them in to make sure they are stable before they can go out. You understand? So most times, if you come into a psychiatric hospital on the ward, maybe you see a lot of schizophrenia patients.
Because you keep them.
We keep them to make sure they come to a good level of function before we let them back into. We don't like to keep people so much because you have to get back to your life.
Yes. So I get that, right? But what cases do you see more of? What
like
cases?
In terms of the conditions?
Yes,
so schizophrenia is one. We could have bipolar. So bipolar is a mood disorder, and it's sort of wavers. So you can have an episode. You can have a manic episode where it gets very elated. Your energy is off the chart. So you're not sleeping. You're having a rush of ideas. Like you are. In history, there are a lot of people that had bipolar, and in their manic phase, they do the crazy inventions and all of that. We have a lot of celebrities, like people in the past who had those things. Like when people get into a manic phase, like it's like super brain or something. You understand? Depending, and I actually really do love bipolar patients.
Fred knows one.
Really?
I don't know Kanye West, but.
Yeah, Kanye West. You understand? You see how talented he is.
Yeah, Chai. Shouts to Kanye.
Yeah, so like I when I got into psychiatry, the first people I loved were bipolar patients. When they're in a manic phase, it's amazing because like whatever their interest and however their life is shaped, you see it in their face. Because like, so the person is into philosophy or whatever, the person will be like maybe seeing a lot of that, like will be revealing a lot of. So I love them for that, but it can be disruptive because like when you're in that phase, you cannot really function because you are fixated on one thing. So we have bipolar patients on the ward too, either in the manic phase or in their depressed phase, because they can soar, they can tank too. Yeah, and usually to some bipolar can come with psychotic symptoms. So as they are like up there like that, they're also hearing voices, they're seeing things. So you have to keep them on the ward to make sure they are stable before they can go. A lot of brainy people have bipolar. So they can have an episode, it can resolve on its own. If they are aware of it, they can resolve on its own. Some can, maybe when they diagnose them, they get on medication, they can actually be fine all their lives on their medication. But the problem with mental health condition is because it has your environment has a bearing on it. So maybe you are taking your medications well, but then you encounter a stressor, something you didn't expect. Maybe your business like falls apart, and you're taking your medication. You can actually enter a manic episode or depressive episode because whatever happened was too much for you to bear. So you come in, we take you in, we try and optimize your medications, make sure you're fine, then we'll let you out. You understand? So you can have bipolar patients who are either in a manic phase or depressive phase. You can also have depressed patients who are having psychotic symptoms or have become suicidal. We need to keep them in and keep a watch on them.
Okay.
So basically, those are many
most of the cases that you see.
Also, we can have I think for most dementia patients, we actually see them on an outpatient basis. Just that it's a lot more of like multidisciplinary. We have to get some caretakers at home, let them know what they're supposed to do for them at home because they're losing function. But I think on the ward, mostly this is what we have. We have a lot of bipolar, schizophrenia, depressive.
Okay,
yeah.
Cool. Why are you guys not working hand in hand with the churches who are mostly based in the forest?
Because it's not spiritual. I mean, faith, we sort of incorporate your faith into our care management because, I mean, if you believe in God, as you're giving the medication, we want you to also like keep your faith so that, I mean, it helps your recovery. But then it's not spiritual. So there's no need going. If you're going to be at the spiritual camp,
are you trying to doubt them?
Oh, I don't doubt their work.
Because they see, because God speaks to them directly. And God doesn't lie. From the Bible, God speaks to these men of God. And
but
once
they lie. They lie.
Oh.
God doesn't lie, but they do lie. They lie.
Fred.
They lie.
Subjective.
I can say with my full chest.
Yeah.
They lie.
Yes.
Yeah, it's not spiritual.
It's not spiritual.
It's not spiritual.
Yeah.
Just waste your time there. They'll chain. They don't even know what they're doing. They'll chain them.
Yeah,
They say maybe.
a friend of mine was chained
Yeah.
for weeks.
So you can imagine how that would affect them, because you're already having the vulnerability of the mental condition and you're being changed. But I mean, I know some people are working, some psychiatrists are working on some sort of studies. So that when you come in, we sort of want to know exactly where you went to, because we are collating some sort of data. We know that this is where you go to. We know exactly what they did for you. So at least I don't know the end goal of the study, but I know some of us like to collect these data. I don't know whether in the long run we're trying to try and get them shut down on something. But it's like the problem with Ghana is that our leaders don't care. That's the problem, because
I don't think.
Thank you for saying that.
I don't think when it comes to church they don't care. I think they are scared.
They are also caught up in. I mean, we're all brought up like that. So you break free yourself.
Yeah.
And some people just continue because it serves them. It serves
Exactly.
them exactly. But if you should use your brain, so you should know that this is not right. You understand?
I would like to lean more towards the don't care part more than scared part. And Mutombo is a great example of somebody traveling the length and breadth of the nation. I don't have that much of experience, but the few times I've done so, I went to school in Cape Coast, so that inevitable, I had to see the journey to Cape Coast. Then I went to Chebi, and then beyond that I went to Kumasi, and then I extended to Sunyani. And I say all that to like crystallize the don't care part about leadership, because it's obvious, if it's obvious to Mutombo and it's obvious to you that there's a disconnect between what the churches are doing to not help mental health issues, or these issues that are brought to them and they try to make spiritual, and also the leadership is aware of those things, then it's not rocket science to say, okay, we have institutions with trained people who need to address mental health issues, because it is not rocket science. This is not news. We didn't just discover this and is skeptical. Psychiatry has a long history of effectiveness and data to show that what they do works. But to buttress your point, it is serving them. And the reason why I brought up my few journeys, and I don't need to travel the length and breadth of Ghana. The moment you leave Accra, you recognize why it is beneficial for every politician to keep them in the state in which they are in. Because we are here talking about, oh, they've stolen some land in cantonments and they've sent some money to some foreign account and they've done this contract. And when I'm driving past these towns, you can see that they could care less about money that was stolen. They're probably not even aware to conceptualize it properly. So it is the leadership that doesn't care. And I think it's a roundabout thing. The people don't care and the leadership doesn't care. We are a reflection of our leadership. It's a sad state of things. There's so many sayings that have been disseminated into the public space. So things like, we're only using 10% of our brain capacity. And then when you look at like maybe the cultural conversations around mental health, things like, even if somebody gets schizophrenic, there's a part of the culture that even finds it, almost fetishizes it, because it says you are your most creative when you go into some of these mental states, and when people try to find different, drugs, if you will, to achieve those elevated states of mind and whatnot. From a psychiatric perspective, what is the stance on it about these ideas of less use of the brain capacity, people trying to elevate their brain capacity, and almost fetishizing some of the conditions that you've spoken about, bipolar, schizophrenia, so on and so forth. Like, how do you guys view it from a professional standpoint?
Okay, so I forgot to mention, on the ward too, we have patients who are in there because of substance use. Okay, so they become dependent, they need help breaking free, then they go to rehab, or they come in because they become psychotic from using the substance, then they need help before they go to the rehab or something like that. But so I guess you're trying to talk about how people try and use sort of these psychedelics to get to some sort of like a
Shrooms.
shrooms and all of that. So over here, most of the substance use is for recreational use and also like an escape from reality because it's hard around here, you understand? And I mean, if you're using it to escape reality, that means there's actually something wrong with reality. So they're already like, there's already like, you already have like a layer of issue already and they're adding the substance use. So for substance use, if you have a predisposition of schizophrenia and you're using substance, you could easily tip into the schizophrenic state, you understand? And schizophrenia is chronic. We are very careful to come to a schizophrenic diagnosis because it's very chronic. When you get that attack, your whole life sort of like has to like change to accommodate that. So we are very careful to throw around those words. But then some of these substances can easily lead you there. It's like you went and you never came back. You went on a trip and never came back. But then somehow outside the country, people are using psychedelics to get people out of depression. So depression is actually, sometimes very hard to treat because take for example, someone already has a predisposition for depression, and the person has been there, has finished school and for like 10 years, the person has not had a job.
Oh.
The stressor is there. The person is going to be depressed. No matter the amount of drugs you throw, you understand? So outside the country, some people, they get to a depressive state, they battle depression for so long. At a point, it's like, I want to just like assisted death. I want to go because it's a lot. You understand? The sun is there, but you can't even appreciate the sun because we have something like anhedonia when it comes to play. Like you can't have pleasure. You can't feel pleasure. You understand? So it becomes so bad. Some people want to opt out. Anhedonia, like a lack of pleasure, like anhedonia.
Anhedonia.
Okay. So like a lack of like you cannot feel pleasure anymore. Like,
when you say pleasure, like
all sorts of pleasure, food, all
like
kinds of sex,
you
and
can't
you're there. All of those things, yes. Because I mean, the reason why psychiatry is very important because the brain / the mind is the seat of everything. So if something goes off there, you understand? But then outside the country, somehow people are using psychedelics to get people out of these depressive states or these chronic mental states. But that's a higher society. I would love for that to come around here, but we already have our whole culture issues about drugs and all of that and all of that and all of that. So I mean, you have to look at where you are and you have to know what you can dabble in. You understand?
That's the environment.
Yes, you have to do that. You have to know. Also around here, there's not a lot of regulation. You know, outside the country, where cannabis is legalized, you actually can see the strength of the cannabis you are taking. You understand? They'll put everything you need over there. Yeah. But over here, we don't even know the strength we are taking.
Boca.
You don't know what they've mixed it with. You understand? You understand?
Boca.
You understand?
GH Gold.
You understand? So it's more of like let's abstain from it because we can't like fully grasp what it says. So let's abstain from it, which is safe because where we are, it's actually safe to do that. Because if I were to say everybody will leave you and you just be wandering the street, you understand? Because there's a whole sort of like issue with the system. You understand?
But you know, just to further the discussion, follow up on what I was asking, our society, by and large, likes to think or say that people have what is coming to them based on some sort of spiritual curse, genetic curse, family curse. Like if somebody goes off now, I bet you the family people will find a way to explain it.
The same thing happened to me. You have that story. I'll tell my story.
So you have like a situation where somebody's holding a vendetta against maybe Mutombo's mother or grandmother. And something happens to Mutombo. The compassion doesn't kick in. They automatically say, yes, Unana did this and that and that, and that is why you are reaping the results. And it is very depressing to observe. I wonder what you in the psychiatric community have in terms of messaging or plans to say, how do we disabuse our society of this? Because it feels like, to me, we stopped evolving. We're almost got stuck into a certain mindset, and societally we haven't challenged it. Like he said, maybe some of the politicians or leaders, quote unquote, are afraid of the backlash because they realize, okay, church is the status quo, we'll get X amount of voting from that block, let's not touch that. But for the professionals, for the academics like yourselves, is there like a conversation happening about how to combat some of these things, the ignorance in our society, and why it feels to me, I've told Mutombo several times on this podcast, I feel like Ghanaians are naturally wicked people. When they see you suffering by the road, their inclination is to think that you deserve to be there. That's why you are there. Car ball, by now, yesterday, you insulted somebody you cheated somebody, that's why you are where you are. We have this affinity for saying people deserve their condition, and I think psychologically, psychiatrically, if that's a word even, how do you guys from your block, from your profession, address that, or what's the message in there, what's the conversation there?
Okay, so we usually have, for all the conditions, we have months where we sort of like do awareness about them. So we have a lot of, it's actually when you get into training, they will tell you that you have to train yourself for media presentations. So we do a lot of them. Maybe this month is schizophrenia month. We do a lot of radio engagement. We go to churches, we go to schools, we do a lot of that. Maybe mental health month, May, we are doing a lot of that. We do a lot of education, but whether they are imbibing it, that's the issue. So I don't have any authority. I'm still in training. But what I do most is in the consulting room. I try to make things as simple as possible for my patients. So you mentioned something about family and things running through and saying that you're having this because your grandfather
is punishing you for.
So there's this thing. There's trauma is not just like a physical. Sometimes trauma is running through families.
Yes.
You understand? And maybe the grandfather had bipolar or something. And bipolar, they also get very irritated very easily. They have angry outbursts. I forgot. They are very over religious. So even some of these pastors that he's in a manic phase and he's doing, and you know how it's more like aura. Like, Bible, and then you understand. So somebody he's even a mental condition.
She doesn't like pastors.
No, they're actually like they're an issue. So like so even he in himself there's a lot that I'm watching on TV. I'm like just picking it up like this guy is clearly not right in the head. But because of many people are very, very, very bold and confident. Like they like own what they say. And that's what most of us, we don't like. Most Ghanaians don't like. Most of us, because of high illiteracy, thanks to their leaders, most of them like they'll go towards this aura, then they lead them on to do all this. But that's one aspect. But in families, there's trauma recurring in families because maybe the grandfather was irritable and all that, and he didn't. So that's the mental well-being. Now he didn't interact with the family members well. So the thing is that when you are in your condition and you're not taking care of it, you are inflicting pain on everyone in the family, and they carry it on. That's what I mean. There has not been a place academically for that. Even though we recognize that some things run through family, we do a lot of family therapy for some families. For sometimes you realize that if you don't bring the family together and explain things together, you are just wasting. Because when they go home, they're going to meet the same situation. So we do a lot of family therapy sometimes, try and get everyone to, and hopefully if they stick to plan, we can like resolve that issue. But some people they don't deal with that, and that's what usually I see around. This issue is a family issue. Like this trauma is a family issue. Maybe this guy had this issue and he has inflicted this pain, and maybe the kids do now think this is the norm, and they act like that towards other people, and it becomes a whole mess. You understand? So it's very important. I think there's a space for trauma specialty that I've seen outside the country. I don't know for Ghana, but then there are people who just work with trauma, like just complex trauma, because sometimes when you out of the womb, it's just trauma upon trauma upon trauma upon trauma. Your family, there's dysfunction, there's marital issues, the father is doing this, doing that. You grow up with it. You also carry it on. You cannot interact well with people you're supposed to love. People don't even know how to love. People have a skewed idea of what is supposed to be the norm. So it's a lot, like, you know.
My question is, again, institutionally, the academic block of psychiatry, because since I was a child, and I know predating me, Bodanfo is not a nice place to be. Stones get hurled at them. They are mistreated. It is like one of the most stigmatized conditions we've ever known in all of our entire lives. No one even wants to speak about mental health because Charlie, the touch, you know, it's an insult when you go to boarding school. But this guy, you don't mind, I mean, the touch. And people are dismissed. People are not even, nobody will give you any dignity if they feel there's a small twitch with your brain. And you said, we care about heart health, we care about kidney health. No one would dismiss you like that. But when it's mental, we go straight to the worst of the worst, you know, undignifying of our fellow human beings. So what do you think you guys in the academic and professional arena of psychiatry can do differently from the previous eras? Because we have so much information, we have so much knowledge, we can see our people, their plight, and diagnose a lot of the reasons. Like, you know, maybe 15 years ago, someone in your seat would not be as bold to criticize the religious bloc. But now someone like you, who has the knowledge and the training, is willing to say what it is. What do you think you guys can do for a more hopeful outcome for our mental health, just as a nation in general? Because I say that the normal people in this town, in this country, are in the minority. I always give a funny example. Ghanaians will see you coming from a distance when you're driving the car. They will never cross the road. And then I wish I could get up from my seat to show you. But you observe, the moment the car they get close, then they start tiptoeing across. Like, man, bomio. And I always try to press. I'm like, what passion do you have for death? That you wait for it to come this close to you, for you to behave this way. But I see it everywhere. People throwing manic episodes, they will do something, they are in the wrong, and their response is, and it's always giddy, you know. So what do you think you guys can do to give us a more hopeful outlook in the future?
I think it's still education. There's not much of it, because I told you, even for us, even the doctors, when I was trying to get into psychiatry, they told me, like, a number of people were like, are you sure you want to do this? But I've always been one to just like follow my passions and all of that. So it's just more education. It should just be more diverse. It's like there are 3 psychiatric hospitals in Accra. There's not a psychiatric hospital in Kumasi, but there's a psychiatric department in Kat. There's a psychiatric department in Ho Teaching Hospital. So that's how little coverage we have, because stigma.
3 hospitals in Accra.
3.
And just departments in Ho.
It's not even 3 hospitals. Okay, 2 hospitals in Accra. Panta is fully a psychiatric hospital. Accra Psychiatric Hospital is fully a psychiatric hospital. Then there's a psychiatric department in Kolebu Teaching Hospital. These 3 public. They are private ones, but usually the private is more like sort of like a snowball effect. Like, I know this person, so go here, because you get a more private. They don't want the public. So the private ones are not really out there. If
they chain them.
But the public ones there's still so much work to be done, because even I think our batch of residents, we are about 20 something. They actually like sort of now calling for doctors to get into psychiatry, because before they didn't have a lot of people to do the work, because it's now coming into the limelight. So we just have to keep hitting. There's no other way. It's just education and awareness, because we're supposed to help you know what this is the norm. This is what not normal looks like. This is what normal looks like. So it's just more education, just more education. That's all there is to it. And also, I was trying to say something, I think I've forgotten. But yeah, there's a lot of education, because the stigma. Because as I was saying, doctors don't even want to enter the psychiatry. So it's now picking up. Now people are picking up. So I think the batch after us is also a good number. But then after the training, they're going to stay in Accra because the hospitals are in Accra. What about someone in the north? You understand? So collectively, we are doing a lot of work, but we are still not doing so much. You understand? So it's just education. So usually we really like thrive on psycho education. When you come to a consulting room, dear, you know proper. But how many people seek the mental health professional to even know? You understand? Because that's where we can give you all the information you need. But out there, you understand? So there's no other way to it apart from medication. It's knowledge that will help.
So my very last question, and that goes back to what you said earlier. We are going to end with it.
Okay.
You have spoken to the two of us. What have you realized, or what have you seen about us? It could be a word, it could be a whole phrase, it could be one page.
I mean,
it could be a quality, it could be anything. It could be anything.
Yeah, I just like the brains here. I love how the conversation has been flowing. We need more of people like you.
No,
because
okay, that's fine. But us, I'm talking about
you want me to psychoanalyze you?
Yeah, maybe how it's Fred like.
No.
Okay, I think and maybe how it's Mutombo like. So yeah.
No, I mean his thought pattern is right. There was no he was on course. He could.
Could you detect some?
That's what we want. We are free.
Big words.
Oh no. It's just a personality thing. That's what you like. There's no dysfunction here.
Once again, a very, very dope episode with Dr. Laryea. Charlie, we hope some of your questions, have been answered. We hope we did well because I came in blank, clean slate, no idea at all about mental health because I know what it is, but I've never had a proper conversation like we just did, and I hope that you guys enjoyed it. Shouts to Atuno at the guitar for powering this season. Fred?
Supercalifragilisticexpialidocious. Whoever reads that comment, that is the biggest word I know. I hope that makes you happy.
Yeah, Charlie. And shouts to our one and only Doc for coming through the podcast. Without
shout out to Doc, man.
Yeah, shout, Charlie. Guys, subscribe, follow, tell your grandmothers to tell their grand uncles about their auntie's best podcast, the If More Let's Divide podcast. So, Charlie, we are done here. This is the If More Let's Divide podcast. Fred,
yes, sir.
We are through. This was good.
Yeah,
Charlie, thanks.